Hi, I'm Dr. Mark Jagger, creator of The Spine Specialist. This video is going to show you basic usage instructions for setting the patients up and for turning the machine on and everything you need to know about its usage. So, power switch is going to be right in the top to the right of the patient here, down in here. Reach down, turn it on. The table will go through its regular homing process to set up everything. It's going to flash blue, and then it will flash again once it's done its homing process inside the machine here for the laser, and then it'll be ready to go. So with the laser will come on when you turn on the switch here. Your password is all zeros, so 0, 0, 0, 0. Enter 4 zeros, then the laser will load and set itself all up. With the tablet, the machines have a console, white console. The tablet is a Microsoft Surface in these models. The console, right at the top left-hand part of the screen, if you go into the back of the console, the power switch will be right about there. You just press it from the back, hold it for a couple seconds, and then the machine will start up. It'll bring you to the password screen, and you'll be all set to go. Now, looking at the laser, you want to make sure it's at about between 8 and 10 watts for power. Brought that up to 10 watts. We're all set to go once we run the laser. Swipe the screen up. You will get a password. Password for these machines are an L-shaped. So it's 1, 4, 7, 8, shape of an L. Then you'll get the screen that gives you the app. Double click that. It will take you into the app, and everything will be set up from there. Traction unit at the foot of the table has a switch on the back of it here. Turn it on. It will beep. You'll see a little blue light and the screen will come on here, if you can see that there. So that's your basic usage instruction for turning everything on. Come to the app, hit LASR treatment selection, and you'll be at the area where you select the different patterns for the laser application. So now to bring a patient into this, we'll set all that up and show you how you should set a patient up. So Alex, come on in and I'll set you up. So Alex is having a little bit of pain in his low back right in the center, right at the lower area of the spine between L4 and L5. Now, there are patterns in the computer here that allow us to select that area. So what we're going to do is, for the lumbar treatment, set Alex up the way he needs to be set up. So Alex, what I'd like you to do is to lay on your back. You're going to have your lower back in the hole here. The painful area of your back should be generally in the center of the hole. Once we get you down there, we'll set you up properly. Now, some patients will prefer a bit of a pillow under their head. We'll get a pillow for Alex just to make him a little more comfortable. There we go. All right, how you doing?
Good.
Good. So L4, L5 is generally at the top of iliac crest here, surface anatomy. So Alex is exactly in the right spot. Now that we have him here, we're going to get him to lift the back of his shirt up and bring the back of his pant down just a little bit to expose the skin to the laser device underneath him. All right, perfect. Alex knows the drill. So now we're going to take this strap here. The pelvic strap should be affixed in a V pattern. So just to kind of grab the hips right about here. So we're going to take that across like that. First strap there. Second strap like that. And then we bring the belt across like that. And clipping the seat belt in. And then tightening it up. Now we always let the patient know two things. Number one, everything is Velcro. So if you feel uncomfortable at any time, Alex, know that you can open the Velcro and get up anytime you like. Also, seat belt, same thing. It's a seat belt just like car, airplane, click, and you're out. Are you comfortable with that?
Yep.
Now that's a very important point. Make sure that the patient answers you and is comfortable with that. That way, if anyone has any claustrophobic tendencies, doesn't feel quite comfortable, they know that they always have control of getting up or down on the table, and they'll be always comfortable. So this upper strap here, same type of situation. You want to go in a V to grab a hold of the ribs, nice and snug. Alex, does that feel tight enough?
Yep, it's good.
Perfect. It should be snug, but it shouldn't be to the point where it feels like it's really drastically restricting your motion. So now from there, you have a carabiner clip here that should float in the center of the strap. you need to bring this strap up and clip that into there. So then you have something for the machine to pull here. When you take the traction unit, you press rope release, pull the rope out, and then clip it onto the strap like so, and hold rope release down again, take out all the slack in that strap so that's nice and tight. Now, underneath the knees, you need to put these bolsters up like that. Sometimes with some patients, if they don't have enough power to lift the leg, you may need to help them lift the leg up onto the bolster. The purpose of the bolster is to flatten the back to get a nice equal stretch over the entire lumbar spine. Now, if some people that have a lot of radiculopathy, a lot of nerve pain, big disc herniations, sometimes the legs might be uncomfortable in that position. Always make sure that you do a straight leg raise on a patient and a Lascelles differential to bend the leg and actually make sure that a patient is going to be comfortable in this position. If they aren't, you can actually leave the leg down as well. I prefer to have the leg up just to flatten the traction out a little bit. And then now from here, you're going to set the traction amount. So you come up, and you can go through the manual a little bit on this to figure out how to do that. Just go through the menus and set up the traction. Through here, we're going to set Alex, let's say, at 65 pounds of pull to start him and 40 pounds for a rest. And then that's ready to go. So to start that up, take all the slack out of the rope, then press the start button, traction will start. From the laser, you want to make sure you press standby so the machine says ready. Now, two things will happen when the machine is ready. You'll have a yellow circle here that says ready as opposed to a blue circle that says standby. Most of the machines also have an LED here that will go green when it's not armed and red when it is armed. This one isn't flashing up red at the moment, but usually you'll see this red and you'll know that the laser is actually ready to go. From here, we select the pattern. So with Alex, he's got L4 to S1 location pain. We're going to select lumbar L4 to S1 focus there, hit confirm pattern selection, and now that is ready to go. The bottom left screen here, a little square, that's activate pattern. Press that button, and now the laser will start up. So you'll hear a fan in the table when the laser starts up. After about 10 seconds or so, this laser will start to beep as it is actually activating the laser to go across Alex's back. And there we go, laser started. So from there, you essentially let the patient relax for the 15-minute treatment. Come back in every few minutes and check on them to make sure they're okay. Otherwise, most patients will just have a little nap and relax, which is a great part of the treatment as well. You want to make sure they're relaxed and comfortable and get a little time to themselves to relax. So, Alex, you doing okay?
Yep.
All right, great. So that's pretty much set up instructions from there. We'll film a few more videos as we go just to show you the different nuances of the device, the different little things you may be able to program into depending on how the patient presents. But this is a basic setup for a patient. So now what we'll do is we're going to stop the machine. There we go. And now we're going to help Alex get up. So sometimes patients are in a fair bit of pain just throughout treatment-wise. Usually after treatment they'll feel a little bit better, but just in case you know the patient's back is still a little bit sensitive, you want to give them a little bit of a hand getting up. So we're going to wait until this machine comes down, and then we'll help Alex out of the straps. So you'll take the strap on Velcro there, and you can undo the seat belt and undo there. Undo this clip and make sure the strap is right down out of the way, away from their legs, so they don't trip on it when they try to roll up. So you'll pull these bolsters out. Thank you. Undo the strap. And now the proper way to get out of the table is, Alex, I want you to roll on your side facing me. All right. And now you're going to use one arm to help push up, and I'm going to help you with the other arm. And that's the safest, most comfortable way. Now, Alex, when you get up, after treatment, you may feel a little bit funny just because we've stretched muscles that aren't used to being stretched. You may feel a little bit unstable on the feet for the first couple steps just because you've been stretched. That's a totally normal feeling. If you feel any pain, that is also totally normal a little bit at the beginning, but most patients don't feel anything like that. So I'm going to get you up and see how you feel. How you doing?
It's good. Nice and loose.
Excellent. Wow, 2-minute treatment, nice and loose. Awesome. All right, great. Thanks for watching. This should give you the idea of setup, and please feel free to email or call with any other questions you've got. Thank you.